most of the superficial muscles of the thorax are going to be extrinsic shoulder muscles, and they are going to act in combo to fix mostly the scapula, but in the shoulder girdle in general, the pectoral girdle in general. They will allow it to move with increased range of motion in terms of the movements of your arm. And the actions are varied and important. So elevation, depression, rotation, lateral and medial movements, abduction, adduction, protraction, and retraction. There are going to be two groups of muscle. One group is going to be anterior and the other will be posterior. The anterior muscles that you need to know include pectoralis minor, serratus anterior, and subclavius. Again, these are superficial. Even more superficial to pectoralis minor will be pectoralis major. And you can see these guys. So let's do a clockwise movement through this list. You can see subclavius. Sub means for below and clavius for clavicle. And sure enough, that guy is going to sit just inferiorly to the clavicle. Subscapularis will sit on the posterior aspect of the, you got it, scapula. Pectoralis minor is located there, attaching from the ribs to the scapula. We don't talk much about coracobrachialis. You have seen at least a tiny little bit of serratus anterior, although we didn't talk about it when we talked about the muscles that support the abdominal wall. You can see the humerus moving to the opposite side and moving up. We've seen biceps brachii, and you'll see that again when we get to the upper extremity. The sternum, there's pectoralis major. Deltoid is going to be important because deltoid is the major muscle of abduction. The deltoid is the most important muscle for abduction of the brachial area. So when you bring your arms up and out, that's because of the deltoid. If you contract the anterior fibers of the deltoid, you are going to have forward flexion of the brachial area. If you contract the posterior fibers of the deltoid, you will have arm extension. And we have spoken about the sternocleidomastoid. Oops, there we go. The posterior extrinsic muscles are trapezius, levator scapulae, and the major and minor rhomboids. So here's trapezius. It's kind of a, when you look at it bilaterally, it's sort of a, I want to say diamond, parallelogram in terms of shape. Here's deltoid. Again, that is the major abductor of the brachial area. This is going to be, I learned it as rhomboideus minor, but rhomboid minor. And this is going to be rhomboid major. These guys are going to help retract the scapula so you do not have rounded shoulders and probably forward head carriage. So these guys have to be strong in order to prevent that. Levator scapulae tells you exactly what it's going to do. Levator for elevate, scapulae for scapula. So sure enough, when this muscle contracts, you are going to basically be shrugging your shoulders because you are elevating your scapula. Latissimus dorsi is a giant muscle that is going to insert on the humerus, and we'll talk about its action soon.